Hey, this is Ava Martinetti, and today I'm going to be talking about omega-3 fatty acids and their influence on our cardiovascular health. My objective for my research for this video was to investigate whether incorporating more omega-3 fatty acids in the diet through its nutrient-rich food sources, such as fatty fish, plant-based sources, or equally through regular supplementation, has a positive or negative effect on an individual's risk of developing coronary heart disease. I was drawn to this topic specifically because I have personally been supplementing omega-3 fatty acids for some time now due to the benefits that I've been told of, which include improving cognitive functions of the brain and the promotion and protection of heart health. But I didn't really know much about these claims, so I wanted to dive deeper and explore why they may or may not be true. What are omega-3 fatty acids? EPA and DHA are the two types of long-chain polyunsaturated omega-3 fatty acids that are most commonly found in animal sources such as oily fish like salmon, tuna, mackerel, sardines, and herring. Whereas ALA, or alpha-linoleic acid, is the third main type of polyunsaturated long-chain omega-3 fatty acids that's found in plant-based sources of omega-3, such as flaxseed oil, canola oil, chia seeds, walnuts, and soybeans, and even in things like avocado or kale. As for the difference between cardiovascular disease and coronary heart disease, cardiovascular disease encompasses all diseases and conditions of the heart and its vessels, whereas coronary heart disease, or it's also called coronary artery disease, is what occurs when plaque in the arteries of the heart, which is a buildup of cholesterol, mainly due to high levels of low-density lipoprotein, or LDL cholesterol, as well as fat, calcium, and other substances, clogs the heart. This excessive plaque in the heart is also commonly called clogged arteries, or atherosclerosis. This plaque buildup will make it more difficult for oxygenated blood to reach the heart, or can even completely block blood flow by contributing to blood clots. This is the most common cause of a heart attack, and about 366,000 Americans will die as a result of coronary heart disease each year. What does the research say? Higher dietary intake of these omega-3 fatty acids, ALA, EPA, and DHA, are all associated with much lower levels of atherosclerotic plaque and less atherosclerotic plaque progression. A meta-analysis of randomized clinical control trials from 2022 had concluded that omega-3 fatty acid supplementation had a positive effect in reducing the incidence of MACE, or major adverse cardiovascular events, such as stroke, heart failure, etc. This study also concluded that no matter the stage of cardiovascular disease, omega-3 fatty acid supplementation can actively prevent the onset of a myocardial infarction or a heart attack. As for the figure shown to the right, this figure is a forest plot of subgroups of the application dose of omega-3 fatty acids and the subgroups of diabetes, NOT, and sex, and major adverse cardiovascular events. And this strongly supports both conclusions of the research that omega-3 fatty acids reduced the incidence of major adverse cardiovascular events and actively prevented the onset of a heart attack in all stages of cardiovascular disease. Another research article, a randomized control trial in 2023, was conducted with the aim of evaluating the effects of omega-3 fatty acids on diabetic kidney disease and type 1 diabetes mellitus, two disease groups which have a disproportionately higher risk of developing cardiovascular disease. In this particular study was a double-blinded, placebo-controlled trial that incorporated 70 type 1 diabetic patients with nephropathy, which is also called diabetic kidney disease. This sample of enrolled individuals was divided in half, with one group receiving omega-3 supplementation and the other receiving placebo. This supplementation was 1 gram per day of omega-3 fatty acid for 6 months. And the conclusion in this study was that there was a strong benefit to omega-3 supplementation for type 1 diabetic patients as compared to control group, as it played a role in the regulation of blood glucose homeostasis, as demonstrated by lowering fasting blood glucose, and HbA1c, and improved dyslipidemia, which is the condition of abnormal levels of cholesterol and triglycerides in the blood. And the figure for this research shows that omega-3 fatty acid supplementation for 6 months significantly lowered the mean levels of triglycerides, total cholesterol, and low-density lipoprotein, LDL cholesterol, also called bad cholesterol, while high-density lipoprotein cholesterol, also known as good cholesterol, was elevated among omega-3 fatty acid groups compared to with their baseline levels or with their levels at end of study among the placebo group. This was also reflected on lowering systolic blood pressure among omega-3 fatty acid groups compared with baseline levels or the placebo group. And this shows very promising results that omega-3 supplementation could possibly be used to prevent cardiovascular disease progression in individuals with type 1 diabetes with nephropathy who are especially at risk of CV mortality, but I do believe that more research needs to be done in this area. As for my conclusion, after the investigation of recent research on the effect of omega-3 fatty acids on cardiovascular health and the development of coronary heart disease through accumulation of atherosclerotic plaque, I strongly believe that the supplementation or adequate dietary intake of these fatty acids has a significantly positive influence. The research presented offers thorough evidence of this. In the meta-analysis, it was concluded that omega-3 fatty acids had a positive impact on reducing the incidence of major adverse cardiovascular events, which all share the development and accumulation of atherosclerotic plaque from elevated triglyceride levels, especially LDL cholesterol, as a risk factor. The research on the effects of omega-3 supplementation for patients with diabetic nephropathy, which puts them at an increased risk of cardiovascular disease mortality, demonstrates an astoundingly positive influence of omega-3 fatty acids in lowering total cholesterol, mainly LDL, which contributes to the atherosclerotic plaque, and increasing HDL levels, which is the good cholesterol that facilitates cholesterol removal from the body. The improvement of dyslipidemia in the diabetic nephropathy patients who supplemented omega-3s shows just how powerfully effective it can be in promoting cardiovascular health. And here are some easy recipes to make a nutrient-dense meal high in omega-3 fatty acids. You could do a tomato, mozzarella, chickpea, and edamame salad with some pesto. If you wanted to go plant-based, you could do a Mediterranean chickpea and tuna salad, as well as a Cajun salmon salad with crispy kale and avocado. And as one last message for this video, don't you forget your omega-3s if you want your heart to be as happy as it can be. Thank you so much for listening. Have a wonderful day.